KUTV Kitchen. We're lucky enough to have their space today. And we're here with Kaitlyn Pacada. She's a registered dietitian that works at Utah Valley Hospital, where I'm from too. So we're from the same neck of the woods.
We are.
And today we're going to talk about nutrition during pregnancy and after. So before we dive right into it, Kaitlyn, introduce yourself to our viewers.
Okay, so like you said, I'm Kaitlyn Pacada. I'm a registered dietitian. I have a bachelor's degree in dietetics and a master's degree in nutrition science. My background work experience started working in a WIC clinic, so I was working exclusively with high-risk pregnancies, women that had just had babies who were breastfeeding or formula feeding and counseling them on their nutrition needs. And then for the past 4 years, I've also been working at Utah Valley Hospital as a clinical dietitian, working with patient care.
Awesome. Well, obviously, you know what you're talking about. So I'm excited to have you share your information with me and everyone.
Me too.
One of the most commonly asked questions I get on Facebook is, what can I eat during pregnancy and not eat? Like sushi. Can I eat sushi?
I get that question a lot because I love sushi as well. It depends on the type of sushi. So one of the biggest things is you can't be eating raw or uncooked meats. And so if you're getting any sushi that has any raw meats in it, you're not going to be able to have that during pregnancy. You're just at a higher risk when you're pregnant for those foodborne illnesses.
Your immune system's actually suppressed a little bit.
Absolutely. Yeah. Yes, because of the hormones during pregnancy. Mm-hmm. And so you have to be really careful with the uncooked meats. You can have the cooked sushi. So you could have a tempura roll as long as there's not any raw sushi in there, and that would be fine.
Do you have to worry about cross-contamination in the kitchen if you're eating something that says it's cooked, but maybe it was prepared with something that was uncooked?
That's a great question. I like to have different cutting boards that I use specifically for my vegetables and other things that are just for meats so that I'm not cross-contaminating and getting those raw food juices on any of my vegetables or anything like that. So you do need to be careful with that.
And wash your hands really well.
Absolutely.
When you're preparing your own food, cook things thoroughly. And yeah, I think that's a great tip to clean up your kitchen area, your cutting boards, everything really well. So that
yes, and I even am a little paranoid with meats, and so I use a meat thermometer.
Oh,
they're really cheap.
Idea.
You can order them online, and then that way you know for sure. You don't have to be trying to judge whether it's pink or not. Mm-hmm. You can just stick the thermometer in and know the temperature and that it's safe to eat.
You don't have to cook it to a crisp. You can actually enjoy it when it's tender, but have it cooked
but feel comfortable that you're not going to get sick. One of the other ones to be careful of is deli meats, especially with the listeria. And so if you do want to have deli meats, you don't want to be eating them cold, but you can have them heated up. Usually they say you want to heat it till you can see it steaming. So if you want to have a sandwich or panini, you could either fry it in the frying pan till the meat's steaming to make sure you've killed any of that bacteria, or you could heat it in the microwave if you can't live without the deli meat during pregnancy.
What about hot dogs? Does that apply to hot dogs too?
I would try to make sure it's a good quality hot dog and then absolutely check the temperature as well, just to be safe.
Because, a lot of people love hot dogs. And actually, This is kind of gross, but when I was pregnant, I craved hot dogs.
So I wouldn't eat them cold, even though it says pre-cooked.
For sure.
Wouldn't be eating them cold. As long as they're grilled really well, you can check the temperature, then I think that would be fine.
Okay, good to know. We probably made a lot of people happy out there who found out that they could eat hot dogs.
Absolutely. What
What other foods should you stay away from? Like fish is a commonly asked question that I get.
Yes.
Like tuna, all that kind of stuff. What can you eat? What
Absolutely.
can you not?
So what you need to be careful of is the fish that's high in mercury, because that can be dangerous. And so
Like
those are usually things we're not eating as often. It's shark, tilefish, mackerel.
And I'm like, what's that?
And most people aren't eating those types of fish anyways, but you just need to know that you need to be careful with those high mercury fish. A lot of people tend to avoid fish during their pregnancy because they've heard, that some fish has the high mercury. But the benefits of eating
the
fish,
omega-3s and all of the healthy fats are so good for you and your baby.
100%.
Yeah.
And so the recommendation is to have about 8 to 12 ounces a week of the low mercury fish. And so some of the ones we eat a lot are the, canned albacore tuna, the light tuna in the can is great. You could also do salmon or tilapia. Those are low mercury fishes. And then the 8 to 12 ounces is still highly encouraged because the benefits are so great. So that's another good one.
Good to know. Any other foods that you should stay away from that you can think of?
Well, the big one's obviously alcohol and those types of things. And then with the caffeine, and so that's when you'll want to talk to your doctor about. Usually the recommendation is to try not to have more than 200 milligrams of caffeine, which is usually 1 cup of black coffee. If you've started your pregnancy drinking a lot of caffeine, sometimes your physician might have you slowly taper down instead of going cold turkey. And so you definitely want to talk to your doctor about that as well. But that is something you need to be careful of during your pregnancy.
Good tip. Me personally, I am a diet soda fanatic. So I one night when I was working a night shift, I took a 32 ouncer to my doctor and I'm like, can I drink this? And he was like, yes. And I'm like, can I have 2? And he's like, no.
Yeah, so there is a limit. Usually you can still have some, try to keep it, less than that 200. But again, if you've been doing a lot, you need to talk to your doctor about how to kind of slowly taper down.
Yeah, because going cold, you're going to get headaches. Caffeine is a drug. And you'll have withdrawal symptoms. So you kind of need to go slowly.
So you need to go slow.
Yeah, good suggestion. So how much weight should you gain during pregnancy? Speaking of food, that has a lot to do with weight gain. How much should you gain?
Absolutely. So in 2009, the Institute of Medicine updated their recommendations for weight gain during pregnancy. And now it's really nice. It's a little more specific. It's based on what BMI category you're in, based on 4 categories.
Body mass index?
Yes, your body mass index.
And how do you find out what your body mass index is?
Probably the easiest way is to just Google it, and there's tons of calculators, which is great. Otherwise, you can do the equation, but then it's kilograms and meters, and people aren't used to seeing their height and weight in those things.
Way easier to just pop those numbers in and it'll
pull the calculator up and it will tell you. But if you have a BMI of 18.5 or less, you're underweight. So if you're starting your pregnancy underweight, the recommendation is 28 to 40 pounds. Okay.
And it's kind of like a mental game. You have to accept that the scale's going to go up.
Absolutely.
And know that that's healthy and normal.
Yes, and I think you need to also look at the type of person you are. And for me, in the future, when I'm pregnant, I know that I'm not going to be the type of person that can get on the scale every day because I think the number will stress me out. And so I'm just going to have the doctor, be in charge of handling that and make sure I'm on track so I'm not obsessing because you need to gain weight. Your baby and your body needs it. The second category is if you're the healthy weight BMI, 18.5 to about 24.9. So you're a healthy weight, and the recommendation is about 25 to 35 pounds.
Still quite a bit.
Which is a lot,
Which in some people's minds, yeah.
Yeah, it can be a little scary, but it's not just, you are putting on some fat stores, which are needed for the baby, but the baby's
we're going to get to that in a little bit. We're going to talk about what you should eat after you've had the baby to make good milk, so stay tuned.
Yes. The third category is if you're overweight. So if you're in that about 25 to 29.9 BMI range, so you're overweight, then the recommendation is a little less. It's 15 to 25 pounds. And then if you are in the obese category starting off your pregnancy, this is all pre-pregnancy weight. If you're in the obese category starting off, then it's 18 to 20. And so, 11 to 20.
And in some cases, the doctor doesn't want the woman to gain much weight at all.
Absolutely. And again, those are general recommendations. Every woman, every body's going to be very different. And so this is where your doctor's going to be monitoring your weight, how the baby's growing, their weight, and whether or not you might need to be gaining more if you're not gaining enough, or if the baby's growing too fast, just kind of being more careful. So those are just general recommendations. Always be consulting your doctor there.
Now, I think there's times in pregnancy when you tend to put on more weight than others. And a lot of women seem to gain more weight between 24 and 28 weeks. And I know I myself gained 7 pounds during that time, but hadn't gained much up to that point. And the nurse was like, you need to eat healthier snacks, which we're going to get to in a minute. And I'm like, I am, but you're putting on a lot of fluid volume. Right. You need the extra fat. Again, it's just a mental game. I have to tell a funny story because I was talking to a patient once who was I think just kind of looking for some comfort because the doctor had gotten mad at her about gaining too much weight in pregnancy. And same kind of thing. She went between 24 and 28. At 28, she'd gained between that month, she'd gained 7 or 8 pounds. And the doctor was like, what are you eating? And she's like, I eat salads for lunch. I eat salads for dinner. I'm so good. I don't know what's happening. And she'd gone, this is what she told me. She'd gone to the store and gotten her king-size bag of peanut M&Ms that was going to last her for 2 weeks, right? And there's peanuts in them. That's good. But she stuffed them in her hoodie pocket right before her appointment because she picked them up on the way. So when she stood up after talking to the doctor about how she ate so well, these peanut M&Ms went all over the floor.
That's so bad.
And the doctor just shook his head and walked out. She had good intentions, so I'm still on her team. Okay, so that's about how much weight you should gain. What kinds of foods should you eat to help you achieve a healthy weight? How many extra calories do you actually need when you're pregnant? A lot of people think they're eating for 2.
Absolutely. That's kind of the old myth is you're eating for 2, but you need to be careful. During that first trimester, it's usually not recommended to gain any weight. That's the first 12 weeks. You don't really need to be gaining any pounds on the scale yet. And most people are kind of sick, so that's usually not when you're putting on the weight. If you're in that healthy weight category...
Now, I just want to add in there, your pants might still get a little tight. Yes. Because your uterus is growing as the baby grows.
Your body is changing.
Yeah, and so as the uterus is lowest, and so as it pushes up, your bowels are going to displace, you're going to start to get a little pooch, you'll have to do the elastic trick with your pants, but that's okay.
Absolutely. Yeah. Absolutely. But during that second and third trimester, that's when the weight should start picking up. And if you're in that healthy weight category, it tends to be, it's 0.8 to 1 pounds per week. is a healthy amount of slowly putting on the weight. But like you said, everyone's body's different. So you might have gone a month without gaining any weight, and then all of a sudden 1 week you gain 5 pounds, and that's okay as long as your doctor's, you're still on track with the baby and how things are measuring. And so a lot of people do think that they need to be eating for 2, which is a misconception. During the first trimester, like I said, you don't need any extra calories, so you can just keep eating what your normal amount is for your healthy weight that you've been at, or just your pre-pregnancy weight. Just keep continuing your normal
That's
dietary
really
habits.
important to emphasize, because I think especially when you're having all of these like food aversions and food cravings, you want to do whatever you can to curb the nausea. And so, maybe you're craving macaroni and cheese, you still shouldn't eat the whole box, right?
Absolutely.
Your baby doesn't need that yet. So
No, absolutely. And then, so during the second trimester, that's when the calorie recommendations do pick up. And they recommend eating about 340 extra calories per day.
At the beginning of the second trimester,
Yes.
which is about 13, 14 weeks.
Absolutely. Yeah. And then at the start of your third trimester, then it bumps up a little bit more to 450 extra calories a day. And so maybe that sounds like a lot or a little to you, but I brought some examples of healthy snacks to show you that it's not quite as much as people tend to think. You're not getting an extra piece of cheesecake to feed that baby every day. Granted, everything in moderation, but I brought some examples. So the first one, just classic example, this is 2 tablespoons of peanut butter, just natural peanut butter, and then an apple. And those were heaping tablespoons, but this whole plate, just the apple and peanut butter, is about 340 calories.
And you could break that up into like an extra snack in the morning and an extra snack in the afternoon. And so maybe eat half of an apple and 1 tablespoon of peanut butter.
Yes.
And then have another snack in the afternoon.
Typically, they say 1 to 2 healthy snacks. It's not 2 meals, a whole extra meal. You don't get breakfast 1 and 2. It's more just some healthy snacks throughout the day.
And this might help you add to the fact that you should be eating like smaller, more frequent meals throughout the day anyway.
Yes. And most women end up being forced to do that when their stomach space is,
Yep, exactly.
And the baby starts taking up all that space and your stomach doesn't have as much space to expand. Usually you do get full quickly anyways, and so you're going to be more likely to just be eating small meals, but you still need to get all the nutrients in.
Good tip. So apples and peanut butter, delicious.
Absolutely. Yes, this is one of my favorite go-to snacks. If you wanted more volume, you could always add some celery because that's super low in calories.
Oh, good idea.
When you hit the calorie max. This might look a little funny. This is just some non-fat Greek yogurt. We just put it on a plate so it's a little easier so you can see it. And then some granola. And this whole plate again is 340 calories. This is the only extra that you need for the whole day. So normal eating habits and then this little bit of extra, or you could split that in 2.
That's actually quite a bit of granola.
Yeah, it's a good amount of granola, which is nice.
Yeah.
This is some chips and guacamole. These are quinoa and black. Yeah, okay. Quinoa and black bean chips. They just sounded good, but I measured out the chips, and again, about 340
that
calories.
That looks like a lot. I don't think I could eat all of that, even if I tried. So again, maybe a good idea to split it between the morning and afternoon.
And then the last one, this is probably one of the smallest looking portions, but just to remind you that things can be healthy but calorie dense.
Yeah.
So you only get 3. Those are dried pineapple little wedges, and then some walnuts, which are very healthy for you. But walnuts are calorie dense, so you're not going to get a whole lot. That's only 1/4 a cup. But again, all of these are the extra that you need. And we don't really need more than that because we don't want to be we don't want the overnutrition. That's bad for the baby as well.
And so this is packed, like you said, packed with nutrition. And I always say this in my videos too, like you could eat a handful of chips or like an apple and have the same caloric value, but the nutritional value is so different for you and your baby.
Absolutely. And usually when you're eating the things like the apples and the whole grains and the granola and the quinoa, it has a lot more fiber and is going to keep you full longer than if you just, chug a glass of juice or something. There's not the fiber in there. You're going to get hungry again more quickly. So having that rough fiber helps keep you full as well.
And pregnancy can cause constipation, so you want to bump up the fiber content in
absolutely.
Food anyway.
Most, all pregnant women are going to be on a prenatal vitamin, making sure they're getting enough folic acid.
If you're on an iron supplement,
yes,
another reason.
That's where it gets hard. The iron supplements during pregnancy are so rough because they almost always cause constipation. And so one of the best tips with that is eating lots of fruits and vegetables, the fiber, the whole grains, drinking lots and lots of water just to help soften that stool. So it's a lot easier because that can be a really common problem.
Yeah, definitely. That's a good tip. Any other tips for pregnant women?
I think just be kind to yourself as well. I mean, we're trying to make sure we're not eating for 2 and overdoing it, but at the same time, stress is bad for the baby as well. And so just being kind to yourself. If you need to indulge, indulge. We don't want to go crazy, but you also don't want your stress levels to go up because you're so focused on the calories and nutrition. Yeah. So I think just making sure you're kind to yourself and try not to be...
all things in moderation.
Absolutely.
Right?
That's
so
my
you
motto.
Could definitely have like your favorite treat every once in a while, and just use, eat the right portion, like you said. You
a serving. Not the whole box.
Piece of cheesecake every day or something. But you can indulge, and that's okay.
Absolutely.
Yeah. Okay, so we said that it's important to gain a healthy amount of weight during pregnancy, but then after you have the baby, it's kind of like all moms are like, it's go time. I want to get this off. I'm done with all this extra weight. And so again, it's also important at this stage to be kind to yourself and understand that if you think you can eat for 2 during pregnancy and go on a massive crash diet and exercise like a fiend and look like your pre-pregnant self 2 months later, you're going to be disappointed.
And that's not realistic or good for you or the baby.
Right.
Absolutely. I mean, think about it this way. It took you 9, almost 10 months to grow that baby and to put that weight on. Give yourself at least that long to try to get back to your pre-pregnancy weight. Most people say, a good healthy goal would be by a year mark. Not trying to do it in those first 2 months. We're not a celebrity doing a crash diet here. We're trying to be healthy and make sure our baby's healthy as well.
So how can you go about that when you're talking diet? Because there's a lot of different pieces to losing weight, right? There's breastfeeding, which we'll talk about. There's exercise, and a woman shouldn't exercise really until she's been given the green light by her doctor, usually 6 to 8 weeks, depending on your mode of delivery. But then there's the diet piece, and you can start with that right away. So how many extra calories should you be eating if you're exclusively breastfeeding, and what would that look like?
That's a fantastic question, and I get this a lot, and it can be very tricky. So when you are exclusively breastfeeding, it's kind of a debated topic. It's a little controversial, but partially because every woman is different. But really, you don't need to be eating a lot of extra calories to be producing the breast milk. One of the most important things is getting enough fluid. Fluid will have a direct and very quickly direct effect on your supply.
You're dehydrated. You're like, what's going on? I'm not making a lot of milk.
Absolutely. So you need to make sure that you're fully hydrated. Listen to your thirst, but most women will sit down and breastfeed and have a glass of water right there with them.
We have if you delivered in Intermountain Hospital, you get this awesome mug.
The mugs, everyone loves the mugs.
Nurseties because you're thirsty and you should drink it while you're nursing. So everyone should have that mug by them and be drinking while they nurse. If that's something that you can associate it with so that you remember, you just need to be drinking.
Yes. So number one, make sure you're getting enough fluids. As far as your calorie intake goes, you need to think of it this way. Your body's producing that milk and it is burning calories, and most of the recommendations throw out the number 500 calories a day if you're exclusively breastfeeding. But most people think they need to be eating a lot more to be making and have that energy to make the calories. You're taking
from the stores you gained during pregnancy too. So
absolutely. So you don't necessarily want to be eating 500 extra calories a day. You'd like some of that energy to be pulled from those fat stores. I mean, that kind of makes sense. You put the fat on, which you need for the baby. It's healthy for you. But then what's so great about breastfeeding is it pulls from those fat stores the energy from it to make the breast milk.
I also have to say hormones go into weight loss too. So some women breastfeed and find that it just melts off, and others won't lose a pound until they stop nursing.
Yes, and that's where it gets really hard because
they may be exercising and eating well and not seeing a difference. And a lot of times it is those hormone changes from nursing. So just keep doing it. It's still worth it because you're being healthy.
Try not to get discouraged because that can be very hard. Exactly like you said, some women, it stops this, they lose the weight the second they stop breastfeeding. Others, breastfeeding really helps them lose the weight. The number that they throw out, because some people like to know a number, the research focuses on about 1,800 calories net a day. And so it usually, if you drop below 1,800 calories a day, that's when they start to see it affects the milk supply.
So that's including exercise, extra calories and everything. So a lot of people have the misconception that exercise will affect their milk supply, but you just need to eat enough healthy food to counteract for that and make the net balance.
Yes, so the net balance needs to be 1,800. So yes, once you are cleared to exercise, if you're burning a few hundred extra calories from your exercise, you don't want your net to drop down to 1,500. It could start to affect your milk supply. And so I usually tell women, if you do want to count calories, which I don't always recommend, then I think it depends on the person. If you have a healthy relationship with calorie counting, then I think you could do that to help you lose the weight. I'm one of those people that I tend to get obsessive, and it's not a very healthy relationship. And so at that point, you can always just try to go
throughout. You know too much about food. That's why.
I know. And so it's usually good for me to just try to listen to my body, my hunger. Your satiety cues. Your body will tell you when you're hungry. The hard part is stopping when you're satisfied and not when you're stuffed.
Okay, so
that's the hard part.
Segue, because we have some examples of how, if you have the right portion on a big plate, you don't feel full. But if you put the right portion on the right plate, it's going to help you feel full. So you brought a couple of examples today. Let's show everyone.
That's perfect. So there's a fantastic book called Mindless Eating, but they talk about how there's a lot of different cues when we're eating that help us to feel satisfied. And one of them is seeing something be full. And so this is the same exact salad.
I totally feel like I'd be getting
I feel like this
plate.
looks like so much more, even though the exact same portions. And so that's just a little trick that I like to use is actually don't eat on the ginormous plate.
Because you're going to fill it.
You're going to fill it.
I can go back for seconds because I hardly ate anything.
And we're kind of conditioned. A lot of us had the parents that, you have to finish your plate, you have to finish your meal. And so if you're going to finish a plate, finish a small plate because you'll just naturally eat less without even trying that hard. And so that's just a little trick that I like to use when I'm really trying to portion control. Is using the smaller plates. Another one too.
And it looks so beautiful too. I mean, when I see this, if anyone put any of this food in front of me, I'd want to eat it. So I think another one of the tricks is just making sure you stock your house with healthy food because that's what you're going to go to.
Yes, that really helps me. I try not to have a lot of sweets in the house. Some people can have their favorite M&Ms in a bowl on the table and it doesn't bother them. I will eat the whole bowl. Yeah. So I just don't have the bowl in my house.
Know yourself and your limitations.
Know yourself. And so if I want some M&Ms when I want to indulge, I'll go out and get them, at the movies or something. And I can't have a whole bag in the house.
That's a good
point. So here's an example of some potato chips. This looks more satisfying to me. It's the same exact portion, but just because it's in a smaller bowl.
Totally. And this is the same exact serving size.
Yeah, and this makes me feel like I need to fill this. Look at all that extra space. I need to fill that. And so this is one serving, but one serving in a small bowl.
If you sat down and ate this whole thing, you'd probably be eating like 400 or 500 extra calories. And,
absolutely.
And you're done for the day.
And the same with ice cream. If I was going to put a cup of ice cream, it would look larger and more satisfying in a smaller bowl than this bowl where I feel like I need to fill it in. And the last one is just some yummy watermelon cucumber juice.
Oh, this looks so good.
Which is a pretty color and has some nice nutrients in it. So this is the exact same amount. This is about 8 ounces. And this looks like so much more. If I had to guess which one had the most fluid in it, I would say this one.
Me too.
And so if I got this, that looks a little sad to me.
It does.
The cup is huge. It's humongous. No one needs to be drinking that much
totally
juice.
Think I need a refill.
Absolutely. At least fill it all the way up. And so
I think a lot of people, let's talk about juice for a second, because a lot of people are afraid of juice, myself included. If I'm I'd rather eat my calories rather than drink them.
Me too.
But you can get some good nutrition from juice. You just need to make sure you're drinking the right amount.
Yes, absolutely. Juice has vitamin C, has antioxidants in it. It can still be a great source, especially if you're not the kind of person that likes to sit down and eat, whole fruits or have the time. It can be a quick way to get some nutrients. But like you said, it's about the portions because there is going to be sugar. It's natural sugar, but it's still sugar. And so trying to limit yourself to like an 8-ounce glass would be great. And then if you are diabetic or gestational diabetes, you might need to be a little bit more careful with the juice. But if you haven't been diagnosed with that, you don't need to worry so much.
We actually got a question on Facebook about gestational diabetes.
Okay.
So she says, this is from Instagram. I just got diagnosed with gestational diabetes, but I can't get in for another week to talk to a nutritionist. What tips do you have in the meantime for me? So let's talk about gestational diabetes in general. I just found out I have gestational diabetes like this girl. What can I expect to find out?
So that usually means they'll do a blood glucose test, and then that's when your blood sugars are running higher during your pregnancy. We tend to be a little more insulin resistant during your pregnancy.
And I think this is so fascinating to me. Your body naturally gets a little more insulin resistant so that there's more sugar in your blood to feed the baby. Right?
I mean, our bodies are amazing.
It's so cool to me.
But we do need to be careful because high blood sugars, really high over the healthy levels, aren't good for the baby. And so then or mom, true, absolutely. And so that's when your doctor, depending on how high they were, they might just put you on a diabetic diet, watching your carbs for the length of your pregnancy.
And what does a diabetic diet look like?
It's really just watching the carbohydrates. It's really just a healthy diet. Most people are eating way too many carbs, but honestly, everyone should be eating a type of a diabetic diet.
It's funny because I work in maternal fetal medicine, and so we see all women that are high risk during their pregnancy, including gestational diabetics or type 1s or type 2s. And especially the gestational diabetics, though, they will have not gained any weight or actually have lost weight from the time they go in and see the diabetic educator until they come back for their next appointment, because once they start following that diet, it's just like all of a sudden it's easy to them to eat healthy. And it's like opening up all these options and just helping people to understand food.
Yeah, and I would tell that individual, ask the question, if you've got a next week, the easiest way to start off, and it just depends. You might end up taking insulin. Sometimes,
sometimes it's diet and exercise. Yes. Sometimes it's oral medication. Sometimes it's insulin. It may progress from diet and exercise controlled to insulin because your needs change as the pregnancy progresses.
Absolutely. And so following your doctor's counsel on that, when you meet with a dietitian, again, it might depend. If you're just doing diet and exercise, they might have you on more general carb recommendations. If you're doing insulin, they might actually have you counting grams of carbs at every meal, which is a little harder. So what I would tell this individual is to start with the plate method. This is what we use in the hospital when we're teaching someone that's newly diagnosed, and it's a simple way to think about it until you can have a little bit more in-depth with a dietitian sit down. So when you're thinking about a plate, I'll use this plate as an example. And again, we're talking, this is maybe about a 6-7 inch plate. We're not talking the ginormous plate over here. When you're having a plate like this, an appropriate amount of carbs would typically be half of your plate should be non-starchy vegetables. So this is actually a pretty big salad. So if we push this over a little bit, if half of the plate was non-starchy vegetables, so that's salads, broccoli, peppers.
Not corn or peas. Those are starchy vegetables.
Yes, not corn, peas, potatoes, which is a big one. So those don't count. So the non-starchy vegetables, you want it to be half of your plate. A quarter of your plate would be your protein. So maybe that's a piece of pork or chicken or steak or something. And then the other quarter of your plate could be a carbohydrate food. So maybe that is your scoop of mashed potatoes or a scoop of rice. And then you could have 2 more servings on the side of carbohydrate. Okay. And so usually you're wanting to have about 3 servings at a meal, especially as a woman. And so this could be a dinner roll, this could be a glass of milk or a glass of juice. But again, if your plate looked something like this, it would be about the right amount of carbs. Problem is in America, we tend to fill the whole plate with noodles. Like if we're having spaghetti.
Yeah.
And then we've got
followed up with some garlic bread.
Yep. Yeah. And garlic bread on the side. Absolutely.
Yeah.
So that's going to be way too many carbohydrates. And if you ate that meal, your blood sugar would go up, which is what we're wanting to avoid. We want it to just be a nice, steady level blood sugar. And so again, instead for a spaghetti dinner, I would say, let's fill maybe half of our plate with a Caesar salad. Maybe let's do a piece of chicken. And then maybe, we have maybe you could count one other one of these as another serving of noodles. So it's not the whole plate of noodles. So it's mostly just rearranging your portions and just making sure the carbohydrate foods are an appropriate amount. And then this could be your garlic bread. And so really, you're not depriving yourself. No, you can still have spaghetti. You can still have your garlic bread. It's usually just adding in a lot more vegetables and just watching your carbohydrate intake.
That's a great recommendation. Okay, so we have another question here. This is from Lauren. I have a 3-month-old and I'm nursing. Are there foods you would recommend to help with milk supply? That's a fantastic question.
So there's not usually specific foods. We did talk about the fluid, really making sure that you're getting plenty of fluids, making sure you're always feeding the baby on demand, because as they demand more from your breast tissue, you will create more milk. And so, if you're skipping feedings, especially when we desperately want to sleep through the night, I understand that, but skipping feedings affects your supply. And so
they may get to the point where they don't need those nighttime feedings, and so they're eating it during the day.
Yes.
But when you nurse more frequently during the day, your body's like, oh, this is when I need to make more milk.
Yes. So your body adjusts, and usually you can get on a good schedule, but don't expect that in the beginning. Baby's going to be up feeding a lot during the night, and that helps establish your supply, which is really good. If you do have trouble with your supply, there's a lot of different things you can do. A lot of times you might be recommended some of the herbs and things like the milk thistle or fenugreek, or you can usually it's called mother's milk tea. So a lot of times we would recommend that to our women when their supply started to dwindle a little bit. And those herbs have been shown to increase milk supply. You can power pump as well.
And I can expound on that for anyone who wants to know about that.
Perfect.
It's like if you have an hour's time, you just sit down in the afternoon. I would say the afternoon, generally speaking, most people notice a little bit of a dip in their supply anyway. So this might be a good time to do it. And out of that hour, you're going to be pumping for 30 minutes, but it's in 10-minute increments. Yes. So you pump for 10, rest for 10, pump for 10, rest for 10, pump for 10, rest for 10. And that takes up the entire hour. And your body's like, oh, I need to make more milk. And if you do this a couple of times, like maybe for a few days in a row, then you should notice a little boost in it. And, while drinking more water.
Yes.
And, a lot of times supply can have to do with the baby's latch. Are they latching properly?
Yes.
And so I would say if you're struggling with supply, talk to the lactation specialist.
Always.
And they can make sure that all of that's good and give you tailored advice about what's going to help you make more.
I always recommend moms always ask to see the lactation consultant in the hospital.
Yeah.
Because they have such a wealth of knowledge there, and when you're coming in and new, or every baby's different too, they might latch differently. To always have one come see you, because they can really help with some of those issues.
And they're available outpatient too, or even down the road at 3 months. If you have questions or need help, they can help you.
Absolutely.
So, any other tips that you'd have for women postpartum wanting to lose weight, or as it applies to breastfeeding?
Be careful when you start. So it just depends on you, but some of the recommendations say maybe give yourself a month or two to establish your supply before you really start the dieting and really, trying to cut back. If you are cutting on your calories, like I said, that 1800 mark is just what the research says. Everyone's a little different, but I would say as you're kind of cutting back. It goes off your
basal metabolic rate,
Absolutely.
Right? So mine might be a little bit higher because I'm
very
taller.
tall, yes. And so someone who's very petite, if you're 5 feet, your basic metabolic rate is going to be much lower. She doesn't need as much calories. She's not as large in stature. And so you might be able to drop to that 1500 and maintain your supply and be slowly losing the weight. Make sure you're not losing it faster than about a pound a week is the recommendation.
That's helpful too for people to know, because sometimes they think they should be losing 2 pounds a week and be down 10 pounds in a month.
No, absolutely not. And actually that can be kind of dangerous for the baby. We have some toxins and things that are stored in our fat cells, and so as our body starts to deplete those and use those for energy, you can actually have too much toxins going into the breast milk if you were crash dieting and losing way too much weight, and so that can be dangerous. You don't want that. And so a pound a week is as fast as we recommend doing it. Don't want it any faster, and that's realistic. If you are dropping way faster than that, you're probably over depriving yourself, over exercising. That's not good.
Yeah.
So keeping it at that steady level. And then if you are fully breastfeeding, you might want to give yourself a month, maybe 2, to really establish your supply. And then you can start cutting back those calories, maybe adding in your exercising once you're approved, and then watching your supply. The second it dips, maybe I need to eat another 100 calories. We're not going to add 800, but maybe let's add 100. Let's add 200 and see if I can still lose a pound a week, maintain my supply, or you could do the power pumping or something like that to help with your supply as well. But your body will let you know. You'll see it on the scale, and you'll see it in your supply if you're going too fast, if you can go faster. So really just monitoring those things.
And for a mother who exclusively breastfeeds and never pumps, she may be asking, well, how do I know if my supply is dwindling? And the best 2 ways to tell if your baby's getting enough is that they're having at least 6 wet diapers a day, because they're just like us. The more they drink, the more they pee.
Yes.
So that's a way to make sure they're getting adequate hydration. And they're also gaining the appropriate amount of weight as determined by the pediatrician. So if you have any questions about your supply, a good place to start maybe with the pediatrician, and they can help you determine if it's a perceived or a real problem.
Absolutely.
I think a lot of times we perceive that it's a problem.
Yes.
And it's not always.
Yes. And I do tell women, when trying to get enough fluids, if your urine is very dark colored, you're probably not getting enough. And if it's a nice light clear color, then you're probably getting enough fluid. So that's kind of a nice indicator as well.
Yeah.
If you're not exclusively breastfeeding, you can start a little sooner, obviously, because you're not having to monitor that. If your baby is formula fed, or even partially formula but partially breastfed, you're not having to worry about supply as much. You could start. Usually they say to go back to your pre-pregnancy amount that you ate. And so before you were pregnant, adding in these extra healthy amounts of calories, just go back to what you ate before you were pregnant.
Healthy foods.
Yes, the same healthy foods.
Yeah.
But as before you were pregnant, and whatever you ate to maintain your weight before, if you're eating that now at a higher weight, then that will slowly bring that weight back down. And you can start sooner, and you're not having to watch your supply. So just depending on where you're at as a mother.
Well, that's good advice. Now, another commonly asked question that I get is, how will what I eat affect the baby? How will it affect the breast milk? Are there spicy foods that a mother should avoid that might affect the baby?
Well, there can be allergies, so that's something to be careful of. Those allergens can go through to the breast milk, so you do need to be careful. Sometimes if a baby is fully breastfed and they're having reflux, upset stomach, if they're crying a lot, it might be a food allergy. And so usually one of the first things they'll take you off of is dairy, which is very hard, because that means some of the really cheeses, ice creams. And so a lot of times you have to cut that out. And that can be kind of hard for a mom as well, having to cut those things out. You do need to be careful with the caffeine when you're breastfeeding, not only when you're pregnant, but when you're breastfeeding, because the caffeine can transfer through the breast milk, and then your baby could be agitated and staying up late. And so whether or not
I know doing this, and it's because you had a soda for lunch. Yeah.
So whether or not you need the caffeine, is it worth it getting it to the baby, and having to deal with those things too. So watching those two things. As far as spicy foods, unless there's allergens, there's usually not a problem.
Yeah.
But again, every mother's different. So I would say watch what you're eating and watch how your baby's reacting after.
Maybe start a journal if you're
That's
noticing that your
fantastic.
baby is
Absolutely.
really fussy, and you might notice certain trends. Like I have a favorite restaurant, and I can't mention it just because we're on air, but we would go there like 2 or 3 times a week, and I recognized the fact that I could not eat there when I was nursing because we went, I got what I normally got, and the baby cried. My son cried all night, and so I'm like, maybe it was a flu, maybe something else is going on. So I must be a glutton for punishment because we went back and I did the same thing to kind of test it. And he cried all night. So I'm like, okay, I just know that that's something I can't eat till I'm done nursing. But, I read a study once that showed that they've compared, say, mothers in India who eat a very spicy diet to women who, in America, who typically eat a more bland diet, and babies in India aren't more fussy. So, I think it just comes down to, it can be very individual. So food journal might be a good way to go about it.
Food journal is a fantastic way. And I would always, write down what you ate and then write down how you felt after and how the baby felt after. Because a lot of times it's hard to say, they were fussy, and it's hard to even remember what I had for breakfast. You've got a lot of other things going on.
And things don't always clear into the breast milk for a while, and so
Yes.
it could have been something you ate for breakfast.
And you can look for those
You
trends.
were thinking about your last meal.
Yes.
Yeah.
So it really helps you to find those trends and those patterns so you can see if there are allergies or spices they're not tolerating, and really try to cut those out, which can be hard, but
Yeah.
sometimes
It's
you
worth
have
it.
to.
It's temporary.
It is temporary,
You can make
luckily.
sacrifices for a while. So this has been so helpful. Thank you so much for coming today. I've learned a lot. I'm sure you guys have learned a lot. And if you have more questions for Kaitlyn or for myself, then you can leave them underneath the live stream on Facebook. We'd be happy to answer questions later too. Again, we just want to thank KUTV for letting us use their beautiful kitchen today. We love them. We have a partnership with them, and we think they're great. So thanks for joining us today. Hopefully you all have a great day. We'll see you next time.